I'd like some clarifications on 2 points. On paragraph 52 of your report, you described that on the 31st of December 2021, 5 vaccines had been authorized for use in the European Union. 4 manufacturers had provided 952 million doses, most of those based on mRNA technology. However, the percentage of vaccine doses actually administered was actually higher because a lot of the doses donated to third countries were actually manufactured by AstraZeneca, and these are viral vector vaccines. So I was wondering, what are your choice criteria? Why have you been donating to third countries the viral vector vaccines rather than the mRNA vaccines? Second question, paragraph 76, where you note that member states had taken on some of the manufacturers' risks in terms of payment of legal expenses linked to the administration of the vaccines. I'll remind you that the Commission the member states who responded to the Court of Auditors' request requested a return to the normal regime once normal relations had been restored. So I was wondering how this affects the mRNA vaccines. If there is no renegotiation on the legal side, what will your reaction be?
Thank you very much. So we take note of that and take that question home. We could reply in writing to that in line with all the rules. There were a couple of points that came up. Some of the points were already addressed before, so I tried to keep it relatively short. On the volumes, 4.6 billion doses, 71 billion euros spent, average cost. I mean, each contract was different. Each contract has different prices. There were different approaches, and at the time when these contracts were concluded, we did not know what is going to work, what's going to make it to the end. I mean, we see that we are still now in the process that we have one product coming, hopefully pretty soon, to get a marketing authorization as booster. No? So that's the finalization then, basically, of this whole process, which is now going on since 2 years. And therefore, it was absolutely prudent to go for this portfolio approach. We also would not know how the pandemic would develop. It was clear that this virus has a huge dynamic and would further develop. So, therefore, better to be safe and better to be on the safe side and have more vaccines than you might need just for one round or a double vaccination, and then you come to an end. Now, when it comes to the effectiveness of the vaccines, these vaccines are highly effective. We see it. We have reduced numbers of hospitalization. We have reduced numbers of severe disease, and that is what these vaccines deliver. One need to choose in a pandemic what needs to be the specificities of a countermeasure, of a response, and these vaccines did fairly well. Now, if you want to have a vaccine that prevents transmission, perhaps by luck we could have got it, but it is not there yet. There is work going on in this direction, but it's a completely different design of these vaccines. Just let me assure you on this one. On the death rates and the figures from the NHS, they're not known to me. I would think that this is highly unlikely from a scientific standpoint and from everything we know about how these vaccines work, that you have the same death rate between vaccinated and unvaccinated. Never heard of this, but okay, I'm not reading everything, and we might have different sources of information gathering. Now on the export, all types of vaccines were exported. So all technologies were exported. And it's not just that it is exported what is left over. No, it is exported what needs, what helps the countries that also request it. The different vaccines have different features. The Janssen vaccine is only one shot. That is very good in certain countries. You have to see that it's not going into the same areas as with the same infrastructure and healthcare systems as we have it in the European Union. So here we are also depending on the wishes and the need of the countries asking for this. On the speed of the whole process, coming up with a vaccination strategy, with a vaccine strategy, I responded to that earlier already. Now with HERA we have a system in place where we can structure these processes and make sure that we have prior agreements and also lines of and also procedures in place that would allow us to procure quickly, ideally already based on pre-reservation contracts, vaccines that would help us to get out of or to address the next epidemic and pandemic. On the transparency point, let me just say that we have been done the largest possible. We have been done everything to provide the largest possible transparency in the negotiations with the companies for the purchase of the vaccines. We have obviously redacted the contracts, but this is done in full compliance with all the applicable rules related to public access to documents. Thank you very much.